Hello, my name is Rachel White, and this is a clinician's resource guide for assessing resilience in military families. The purpose of this resource guide is to provide therapists working with military couples and families a source of research-based instruments that assess resilience. One might ask, why is resilience particularly applicable to military couples and families? Why is this important? Military families experience a multitude of adversities on top of just regular life challenges and stressors that civilians face. And so some of those adversities include things like continued relocations, lengthy training and deployment separations, the constant threat of injury or death for the military personnel, including when they are on trainings or deployment, and then also continued lifestyle themes of detachment. So detaching, having to move away from one's social support system, one's other family members, friendships created, maybe even other military families as you get orders to move. And research tells us that such adversities lead then to heightened levels of depression, anxiety, adjustment issues, distress, and then also the likelihood of having increased triggers, so responding more often in a reactive manner to things going on in the environment around us. And how then does that this information have anything to do with resilience? Well, we know now that we can assess resilience. Resilience is the ability to bounce back, to maintain psychological health in the face of adversity. When difficult stressors or traumas happen in life, to be able to heal or to come back more quickly than others. And we know that some individuals are able to bounce back essentially or have more resilience than others. And so assessing military family members, from the military personnel to their spouse and even their children if they have them, we have the ability to assess this resilience, and then through treatment, through therapy, to build upon the resilience and really support the military community. Doing so will greatly benefit not only the community of the military culture, as overall functioning and health improves for these families, but also civilians as military personnel and their families re-enter civilian life after either discharging or retiring from the military. And so there's great benefit to facilitating these assessments with our clients, one working with couples and families as a part of the military culture. There's great benefits to both the military culture as well as the civilian culture. So, let's see. So I'm going to go through and provide a list of the assessments that can be utilized in order to assess the resilience of these military family members. The first is the Deployment Risk and Resiliency Inventory 2. This is a widely utilized instrument. It has been created specifically for the military, and so it's widely utilized within the military realm. It measures resilience and risk-taking and risk factors with war veterans. And so it's the only measure that I've actually been able to locate that was specifically created for the military population in order to assess resilience. And so this is a great resource to utilize to assess the resilience experience within the military personnel that we may have within our family therapy clients. The downfall, however, the weakness, is that it is a really pretty lengthy assessment. And so the length of the assessment can be a turnoff for those of our clients whom we would like to take the measure. It has 210 questions and is considerably longer than the alternative resilient instruments that I'm going to be talking about. So, some benefits of this specific measure are that it identifies the client's experience of trauma before, during, and after deployment. So this is not only specific to the experience of deployment, but it also gives us a lot of information regarding their family history, regarding some of the other trauma factors that have impacted resilience for these war veterans. And then it also goes into social support within a multitude of relationships, including coworkers, including one's spouse, including other family members, social support experiences with family of origin. And then it also delves into the perceived threat and preparedness for such threat. This tool can be incredibly helpful for those clinicians whom are wanting to explore more of the resilience with their military personnel whom they have in couples and family therapy, especially if you are wanting to address social support issues, wanting to address family of origin issues. And it can be incredibly helpful for identifying a treatment plan and treatment plan goals. And so, especially for clients who may be in denial or not wanting to talk about different things, if they do self-report some of this information within the measure, it can then be brought into the therapist room. And so those are some great benefits to this measure. The next measure I'm going to go over is the Connor-Davidson Resilience Scale. So this is a 25-item scale. It's an incredibly popular measure. It's probably been it is the most widely used measure of resilience that I've been able to find, particularly across populations and cultures, and it also has been utilized with military populations. And so this could be used with the military personnel or their spouse. And it can be used for both. So it evaluates the resilience of the individual, specifically the competency, toughness, and adaptability that the individual has. And within therapy, this can be an incredibly effective assessment. It allows the clinician to assess the patient's an ability to endure stress, adapt, what their social problem solving skills are, as well as previous experience of successes. And so all of this information, having information about what available social problem solving skills someone has, is really important because that can be built upon. And so knowing what is already there for creation of treatment plan goals, again, can be incredibly helpful. Also, knowing previous experience of successes. This is going to be really important when I begin talking about some of the treatment options. And so being able to remind the client to change their worldview and identify what some of their successes are to hopefully alter what some of the mindset is. And this also can help build upon resilience. So Also their ability to endure stress, their patience. These things are going to impact the family system, of course. And so having some of this information is going to be helpful regarding addressing the dynamics within the spousal relationship, maybe even within the parent-child relationship, and being able to have an idea for what some of the treatment goals are going to be moving forward within that. Next, the brief resilience scale. This is a short 6-question measure. It specifically asks the client things about are they able to bounce back quickly, or what their perception is for being able to bounce back quickly after experiences of success or of stress. It has a good amount of clinical research backing it regarding its reliability and validity. This is an excellent resource that could be utilized or an excellent tool to measure every so many sessions what the resilience level of the family members is. And so to be able to track and to scale if there have been improvements and what that is going to look like. If there haven't been any improvements regarding the resilience, maybe techniques need to be altered, maybe some things need to be changed up within the therapeutic situation. So the resilience scale for adults, this is a scale that evaluates 6 protective dimensions that impact resilience. This includes perception of the self, the planned future, social competence, family cohesion, social resources, and the structured style. And so this, while it hasn't been created specifically for military, and I was not able to find that it's been utilized within the military population previously. It definitely has been utilized across other diverse populations, and it can potentially provide insight within the therapeutic relationship as to what the social resources are within the family unit. And so assessing what family cohesion looks like within the family is going to be incredibly helpful regarding what some of the dynamics are, addressing some of those dynamics, how the family addresses conflict, does the family work together, and so forth. And so this information is going to be incredibly helpful for family therapy and couples therapy as well. The resilience scale for adolescents, this scale was created from the resilience scale for adults. It has been altered slightly in that a few of the questions' language has been altered, and then 2 of the questions were taken out because they were not applicable to the experience of adolescence. However, this can definitely provide some information regarding the experience of family cohesion for the adolescents within the family system. And oftentimes this is a perspective that's overlooked or not even forgotten about. And so this is an awesome opportunity to bring these other perspectives from the children, from the adolescents into therapy to be able to work on resilience within the whole family unit. As this model that has created both the resilience scale for adolescents and the resilience scale for adults follows the model that family cohesiveness is strongly correlated with resilience. So then the resiliency questionnaire for adults, again, this was not created for a military population. This measure could be an awesome tool to utilize in order to assess emotional reactivity, and symptomology for the military family units. And so assessing this information, again, is going to be incredibly helpful for creating the treatment plan and treatment plan goals moving forward. The last then assessment that I am going to be bringing up is the resiliency attitude and skills profile. And so this is another instrument that can be utilized for treatment with youth in the military families. It assesses how the client approaches different situations, and then the skills that they have in order to address these events. And so this is going to help to build skills with the adolescents or youth that is going to help build upon the resilience. And in addition to this, within family therapy, working on building these skills as a family unit is going to be incredibly helpful for family cohesiveness and build upon the resiliency as a whole. So then the analysis from a systems perspective. From the perspective of structural family therapy, the model of structural family therapy approaches therapy with the assumption that the primary challenges within the family unit are adjusting to change. And the strength of the family system depends on the abilities of family members to mobilize alternative transactional patterns when internal and or external conditions of the family demand restructuring. So this is the core of what resilience is. The goal within this theory is to be able to adapt to stress for the family to come together as a whole in a way that's appropriate and boundaried, but to restructure the family so that the family is able to work together and adapt effectively to change moving forward. And so this is also the goal for addressing resilience, being able to be more resilient, to bounce back, to come back after having traumatic or stressful circumstances happen to someone. And so this analysis from a systems perspective is going to be utilizing techniques that come from the model of structural family therapy. And the first is joining. So the therapeutic process of joining happens when the family accepts and trusts the therapist as the leader of the process. So joining is an essential technique, and without joining, according to this theory, there's not going to be a whole lot of progress made forward, because that means that the family has not fully trusted the therapist to really take a leadership position. And so joining is incredibly important, and some ways to build upon joining within the therapeutic relationship to build trust is going to include to be authentically empathetic, to be open about for the therapist to be open about the expectations within therapy. And from the perspective of also dealing with military families, because the therapist is seen as a leader, it is also important for the therapist to be modeling appropriate leadership characteristics. That may include if the therapist is not familiar with working with military families, then asking more information about cultural factors and experiences of the military family. And this would be then expected for the therapist to participate in during therapy. The next is reframing. So this is a process of altering maladaptive thinking, maladaptive statements to oneself into more positive statements. So again, going back to a few of the assessments, finding strength in previous life experiences, finding successes is going to be incredibly important. Restructuring. So this is restructuring the family system in order to challenge a worldview of the client, particularly in regard to resilience. Challenging the family structure is an incredibly helpful technique. And in order to challenge the family structure, one must identify and have information about some of the dynamics that are already happening. And so much of this information can be gotten from the assessments, from family cohesiveness, how to deal with conflict, and then also from the initial interviews and so forth from when the clients have come in. Nonetheless, restructuring the family is going to look like challenging where family members are sitting. It may be if a child is sitting between two parents, and a primary goal within structural family therapy is for the parents to work together as a cohesive subsystem and to set appropriate boundaries and to model appropriateness. If the child is sitting between the parents, a structural family therapist might ask for the child to move and to sit on the outside of the parents, to have the parents sit together, to empower the parents to come together and work together in leading the family. So this may also include creating a family map, which is going to show the positions of different family members in relation to one another, what the relationships are like, what the conflicts are going on, coalitions, affiliations, and ways that they group themselves during times of conflict. Next, enactments. So enactments are a way for the therapist to better understand what the dynamics look like in the real world, outside the therapy room. And so this is going to look like allowing the clients, or instructing the clients maybe, to discuss a certain topic, or to have some type of conflict. And so this often happens as spontaneous enactments, where a couple will begin arguing in front of the therapist, and the therapist is going to watch them and observe them, and may allow this to go on until the therapist believes that it's therapeutically appropriate to stop. And so after the enactments, the therapist can then intervene by increasing the intensity of the situation, particularly if you have family members who are pretty disconnected or avoidant. The therapist can include other family members, can identify alternative ways for the interaction to have gone, or even identify insights that the clinician has about the interaction. Okay. So then, the application of this resource guide, can be utilized by clinicians whom are working with military couples and families, and is an excellent resource just to go to look through the different assessments, to identify which assessments are even options to utilize when working with your clients. Also, it can be really helpful to read through the different techniques when feeling stuck with a client. And to have a resource that utilizes evidence and identifies the benefits of working with resilience can be incredibly helpful. So, moving forward, the greatest importance is for us as clinicians to begin to explore evidence-based research. And this is essential for impacting change within the field, especially with different populations that may not be researched as much, different themes and topics that may not be researched as much, or different themes and topics that we have less information about or need to continue to update ourselves regarding what the clinical evidence is showing us works with our clients. And so it's incredibly important for us as clinicians to continue to research and continue to broaden our understanding of the different evidence-based research that's available. And with that, that is the end of this resource guide, the overview of the resource guide. So thank you for joining in with me, and have a wonderful day.